Caring for someone with ALS, it's one of the most profound challenges anyone can ever face. It asks for so much strength, so much patience, and just a deep, deep sense of humanity. So today, we're going to build a kind of compass together, a practical, compassionate guide to help you find your way through those really difficult moments of distress. And the goal here isn't perfection, not at all. It's about finding the power in just being present.
Okay, let's just get this out of the way right up front because it's the most important idea we'll talk about. This quote, I want you to think of it as your anchor. It's about giving yourself permission to not have all the answers. Your role isn't to be some kind of perfect mind reader. It's just to be an attentive, curious partner on this journey. That's it.
So here's how we're going to break this all down. First, we'll look beyond just the physical tasks to really understand what's going on. Then, I'll introduce you to a core method I call pause and decode. After that, we'll get into the practical stuff, toolkits for both physical and emotional challenges. And finally, we'll wrap up by talking about how to keep this going, how to make this level of care sustainable for everyone involved.
All right, so first things first, we've got to kind of shift our perspective here. Because truly effective care, it's not just about a checklist of tasks. It's about developing this ability to understand the really complex inner world of the person you're caring for, especially as their ability to communicate starts to change. This is so crucial to get. These different kinds of distress, they're not in their own little boxes. They all overlap and bleed into each other. So what looks like agitation on the outside might actually be coming from physical pain on the inside. Or what appears to be withdrawal could be this overwhelming anxiety about their breathing. They're all connected.
And that really gets to the heart of it all. It means we have to become, kind of like detectives, right? Always looking past that first surface level behavior and asking ourselves, okay, what could really be going on underneath this? That curiosity, that is the absolute foundation of compassionate care. Okay, so that's the what. But what about the how? How do you actually do that in a really stressful, high-stakes moment? Well, we use a simple, but believe me, incredibly powerful technique called the pause and decode method. This is your go-to move, your blueprint for staying calm and responding effectively. So instead of that instinct to just jump in and fix everything immediately, you just stop, you pause, take a breath. That one little action creates the space you need to actually observe what's happening. Then you try to interpret those cues. That's the decode part. And only then, after all that, do you act. See how that works? It totally changes the game from a panicked reaction to a really thoughtful response.
Okay, so when you're in that observe step, what are you actually looking for? You're looking for these nonverbal cues. Because when words are hard to come by, the body, it's still communicating. It has its own language. Learning to read these signals, a grimace, a sudden stiffness, a change in breathing, that's what turns panicked guesswork into truly informed care.
All right, theory's great. Now let's get practical. Let's actually put this method to work, starting with how you respond to physical distress. These are often the most common, and luckily, the most fixable issues you're going to face. This is the question, right? Every single caregiver asks this. You're in a moment of distress, it feels completely overwhelming, you can see something's wrong, but where do you even begin? What do you do first?
Well, the answer is to have a system, a checklist. Think of this check everything framework as your mental go-to list. So instead of just randomly guessing, you start at number 1, position, and you just work your way down the list methodically. It brings order to a chaotic moment and helps you track down the real source of the problem. And let's be super clear about this. Pain in ALS is real. It is absolutely a real thing, and it's often under-recognized. It can come from muscle cramps, stiff joints, just being immobile, lots of things. And your job isn't to be the doctor here. It's to be the expert observer who can spot the patterns and then report those patterns to the medical team. So, when you think pain is the issue, here's your game plan. First, try to figure out where it is and how bad it is. Then, reposition first. Seriously, just a small adjustment can sometimes provide huge relief. It's so often the best first step. And remember, making a note of these patterns helps the whole care team make smarter decisions down the road. Okay, let's shift gears now. We've talked about the physical, but navigating the emotional side of things, that's a whole other challenge. Responding to the intense anxiety, the deep frustration, and the profound grief of ALS is every bit as critical as managing physical comfort. And this is where deep empathy becomes your superpower. You start to see that an outward behavior, like irritability, is almost never just about being irritable. It's the tip of the iceberg.
It's often the external sign of a deep inner frustration, like not being able to communicate a simple need. Understanding that connection, well, it changes everything about how you respond.
You know, when someone is hurting emotionally, our first instinct is usually to try and cheer them up, right? To fix it with positivity. But saying something like, stay positive, or you're fine, can actually feel like you're dismissing their pain. What's infinitely more powerful are simple statements of validation, like, this is really hard, and presence, like, I'm here with you. You're not trying to fix the feeling, you're just being there with them in it.
A lot of the time, frustration comes from that feeling of losing control, of losing agency. So, one of the best things you can do is find small ways to give a little bit of that control back. Offering tiny choices. Do you want the blue cup or the green one? Or should we do this now or in 10 minutes? Can completely de-escalate a situation because it restores a little piece of that person's autonomy.
All right, for our last section, we're going to zoom out a little. We're moving from reacting in the moment to being proactive. This is all about how you create an environment that actually minimizes distress in the first place and makes this whole journey more sustainable for everyone.
You know, the best way to handle a crisis is to prevent it from happening in the first place. Things like predictable routines. They reduce anxiety because there are fewer surprises. And anticipating needs, like adjusting a position before it becomes uncomfortable, stops distress before it can even start. All of this consistency, it builds a powerful sense of trust and safety.
Okay, and now, this next part is just for you, the caregiver. And I really need you to hear this. You are going to get it wrong sometimes. You're going to miss cues. You're going to feel completely and totally overwhelmed. And that does not mean you are failing. It just means you're human in an impossibly difficult situation.
Taking care of yourself isn't a luxury. It's not selfish. It's actually a non-negotiable part of providing good care for the long haul. Talking about a hard moment afterwards, letting other people help, taking real breaks, and just giving yourself grace to be imperfect. These aren't extras. They are essential tools for your own survival and sustainability.
And this is why all of this matters so much. Because every time you pause, every time you observe, every time you respond with care instead of panic, you're doing more than just solving a problem in that moment. You're building something huge. You're weaving this incredible safety net of trust and safety and relief. And most of all, you are upholding dignity.
So let's end with this. Let's completely reframe what it means to have a good day in this journey. The goal isn't, did I fix everything perfectly? That's impossible. The real question, the one that truly matters at the end of the day, is simply this one. Did I show up, pay attention, and respond with care? Answering yes to that, well, that's everything. That is the true heart of compassionate care.